Cutting Edge Benefits podcast with our host, Tom Quigley of ClaimLinx. Tom, what's going on, man? You living the dream?
I'm up in a dry area of the mountains in New Hampshire and Maine. They're a foot of rain, 12 inches below what they need. So you can't have fires or anything because of the fire risks. So no campfires. You just sing with the propane gas, fire thing, kumbaya and stuff instead of the real fires.
Our topic today, this is awesome, is the hospital debt crisis. Lessons from employers from the headlines. We see constant headlines about families drowning in medical debt. Why has this crisis become so widespread?
Because they're not taking advantage of vehicles that would allow them not to have that debt. They don't understand negotiating. They don't understand grants that are available. They don't understand a lot of things. And the problem is, it's stems from where they were. The employers aren't buying the health insurance very intelligently. You have people now with $8,000, $7,500, $5,000 out of pockets. And if you think about a $5,000 deductible, an employee, if they hit it, every hour they work for the employer, it costs them like $2.41 if they work a 40-hour work. Think that through. So if you're making $20 an hour, now you're at $17.59. Now your spouse hits it. Now you're at $50. That's the way it works because the employers aren't doing their job fiduciary. They're letting Susie and Jimmy, the HR folks, make decisions for the company who aren't qualified to make those decisions, period.
How does the rising problem of hospital debt affect employees' financial and mental well-being?
The hospital's trying to hound you for $5,000, $6,000, $10,000, whatever it is. They keep sending you bills and threatening letters, and then you get collection calls. It's a little stressful.
Totally. I want to ask, how do you negotiate? This would be a great tip for our listeners out there. Negotiate with a hospital when you have a medical debt you can't pay in full.
You set up payment plan. Worst case, tell them you can only afford to pay $75 a month, and it's no interest, and you just pay the $75 each month. But you can also agree to pay up front. So what will you accept as payment in full? And a lot of times they'll knock 20% off the bill. They're getting a little wiser on some of those. But another one, they have great programs at the hospital level that will pay a portion, if not all, of your deductible, but they don't tell you about it. So you ask them about it.
And there's the organizations out there helping, and ClaimLinx is one of them, right? You look at those grants for people?
Help, and there's also other great sites on like, for example, needymeds.org is a great site for people to go on, and there's grants for diseases, grants on drugs, there's grants for almost anything. You can even get a service dog for some of these grants for kids with autism. My nephew had a service dog for a while. It's interesting. Good stuff. You got to do research. For example, if they said, okay, Neil, you got 6 months to live. You got this XYZ disease. You find that there's people that told that and they're still breathing 20 years later because there's programs that are available that, quite frankly, people don't know about.
Yep. You got to do the research. You got to search. You got to do that. I would get on AI and I would be living on AI, trying to figure it all out and asking 88,000 questions if that would happen to me, which it hopefully won't. And I would just go and say, I'm not going to take no for an answer. That's it, period. And that's what you have to do with anything.
With that approach on your health insurance, you would be paying a lot less.
Yep. What hidden costs or gaps in traditional health insurance plans often lead workers into crushing medical debt?
If they have an ACA compliant health plan, there's really not. Everything's pretty much covered. It's these minimal essential coverage plans that are a joke that some employers have implemented to avoid the tax. They have gaping holes. They cover a per day at the hospital. So let's say they give you $1,000 a day, that your bill's $5,000. Well, you owe the difference. I helped a lady who had COVID. She had a $64,000 bill at the hospital, and I knew there was a grant from the Health and Human Services, so she got the grant. Nothing. The hospital administrator, when I said, did you apply for it yet? You're supposed to, because they are. And she was like, oh, we haven't. And they didn't. She got it. Instead, they were billing her, sending her the questions, all this stuff. But I stepped in. The funniest part was the employer didn't go back, listen to me on how to save money on their health insurance, and kept the shitty minimal essential coverage, which I promptly laughed at them because it was funny. So your employee just got burned. I saved her hearing because the Aflac agent, knew me and asked me to help because you have Aflac. And I go, I got to listen. Okay, good luck.
And do you see a lot of companies that, because their employees go to the hospital versus going to somewhere else, the education is an important part of it?
Yeah, the emergency, the first thing you should do, there's telemedicine, and you call telemedicine up, have a quick appointment. Like when my wife got stung by bees a few weeks back, first thing I did is I called the telemedicine and said, what should I do? Get her to urgent care emergency room immediately, because if she has an allergic reaction, she could, they use words like that. So we went to the urgent care. They gave her some drugs. She was fine. But the issue is most people don't do that. Another one, you're sitting at home, you have a 102-degree temperature and it looks like they have strep throat. Go to the mini clinics or the urgent cares instead of the emergency room. Why? Because the cost is about 90% less.
Then
so you're an employee. You set your medical insurance, if you listen to us, you set your medical expense reimbursement plan up so that the copays for using those are drastically less, which makes people smarter. The kid's out playing baseball, dives in the second, has a huge gash, has to stitches. Don't go to the ER, go to the urgent. There's no urgent care. You go wherever you have to go, you get it done. I'd do it for you, but the kid's knee would look like a tic-tac-toe board. That's the kind of things you got to be smart. But the problem is, they get a $3,000 bill and then you have these doctors you didn't even see who peeked in and said, how are you? Good. It's $200.
So that's why you got to go to ClaimLinx.com and schedule a call with Tom today and his team, because your company, but also individuals listening, don't follow some of these rules. You got some unbelievable tips from Tom today. Appreciate it, sir.
No problem.
All right. That was a special simulcast of the Neil Haley Show and the Cutting Edge Benefits Podcast.